Assalamu alaikum wa rahmatullahi wa barakatuh. A very good morning and goeiemorgen to all our beautiful ladies. My name is Aisha Adams and it is truly an honor to welcome you all to our Women's Health Day here in Parkwood. Today, we gather not to just listen, but to learn, to share, and to strengthen our understanding in the issues that affect women's health in our communities. So, I'm just here to welcome you all, to introduce you to everyone, and to make sure that none of you guys sneak off before our lucky draw. Alright, before each speaker or after each speaker, we will be having a lucky draw. So keep your ears open and eyes on the prize. Today might be your special day. Right, to begin our program, I'd like to invite Asima Umar to officially welcome us.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Asima. I'm a medical student. On behalf of the Islamic Medical Association, I'd like to welcome you to this amazing women's event. First, we thank Allah subhanahu wa ta'ala to grant us to be a blessed event. Alhamdulillah, thank you for coming out on this beautiful morning. We thank our hosts for taking the time out to provide an enriched service to the community of Parkwood. Today, you'll get to check your blood pressure and your sugar levels, or you can have a pap smear done. Our beautiful team will do cutting, wrist examinations, and provide football. There will be a series of talks on various topics such as sexual health, mental health, gender-based violence, and cancer awareness. Just a note for those coming for the pap smear, your result will be communicated with you whether it's normal or not. So everyone should receive a call. You'll receive a call from Dr. Musa within 1 to 2 weeks, so please answer if you receive a call from this number. You don't need to write it down, but just so that you're familiar with it. 084-587-6816. Again, all around this event to be followed with all the barakah and khair, and I hope that you take all the benefits from what this event has to offer. Shukran.
Shukran so much, Asima Umar, for the warm welcome. Our first session will focus on sexual health and STIs, a subject that is often overlooked but absolutely essential for women's well-being. Please join me in welcoming Sister Lehman. Sister Lehman, are you with us? Thank you so much.
Good morning, everybody. I'm Sister Lehman. I am one of the sisters that works at Parkwood Clinic, and with me is my team, Sister Alexander, and then our Ian that does the family planning on the other side, Ian Kusi. It would have been nice if I could have showed you guys the pictures on the screen, but I don't know, there's a lot of hiccups this morning, so please just bear with me. You can stop me anywhere along the line if you want to ask some questions. If I'm using words that is way too big, please stop me and ask or say please go back. I just want to give you guys a bit of education on STIs and also family planning. STIs, it's a sexually transmitted infection. It's caused by different kinds of germs, so bacteria, viruses, parasites, and fungi. And a person can have more than one STI at a time. It's very common in our community. This is why we're speaking about it today, because at the clinic, this is what we see a lot in the Parkwood community. So we would like to bring awareness and see what we can do to improve that. So symptoms of an STI, we will be sitting here and we don't know what symptoms is. So if you're experiencing unusual vaginal or penile discharge, if there's blisters, itching or pain in the genital area, that is not normal. Just go to your nearest day hospital, your nearest clinic, and tell the sister or whoever you're speaking to about what you're experiencing. Sometimes people who's infected with an STI, they have no symptoms. And then all of a sudden one of our partners goes to the clinic and then the partner has symptoms. Partner comes back home and they say, they treated me for whatever STI and now we are shocked because I don't have any symptoms, how come you have symptoms? So what we usually do, if we are treating a female, we give a slip and we say give this to your partner. If you have multiple partners, we give you multiple slips because all your partners needs to be treated. Otherwise, you're going to get re-infected and come back with the same problem the whole time. even if you don't see any symptoms, STI can still spread to others, and they are highly contagious. So it's very difficult if you don't have any symptoms and so you don't know if you have the STI and yet you are still spreading it. But as soon as you experience anything abnormal within your genital area, that is when you report to your nearest clinic or your hospital. Most of the STIs can be cured. We have antibiotics for most of them. If STIs are not treated, they can cause serious health problems, such as infertility in both men and women. So now you're struggling to get a child, you want to fall pregnant, but you're not falling pregnant because there's a STI that is not treated yet. And also it causes miscarriages and stillbirths and birth deficits in children, and newborns are born with spina bifida or any other problem. It's because of STIs. Not always, but it can cause that. Increased risk of getting HIV infection and also cervical cancer. Remember guys, this is all by the vaginal area. If it all stays there, that infection is untreated, it can lead to cervical cancer. So the earlier one goes to the nearest facility or day hospital or clinic, get treated, the easier it is to cure the infection. And then you must remember to always finish your medication. People like to say, whatever illness you have, whether it's an ear infection or throat infection, we use antibiotic. If by day 2 or by day 3 we are feeling better, we stop using the antibiotic because we are cured. We are not cured just yet. We have to finish the course of antibiotics that is given to us for a reason. Our bodies are going to become resistant to the antibiotics that is given to us if we just stop it every time. And then also, like I said, your partner must be treated, tested and treated as well. So how we prevent STIs, we call it the ABC mechanism. The A meaning abstain, B, be faithful to one partner. It's not difficult. It's part of your personality. One partner is enough. We don't need multiple partners. We're going to end up with multiple problems. We don't need them. And C, condomize. Whatever you do, please try to use condoms. And then we do cancer screening at the clinic. That is what we're going to do here today. Very convenient on your doorstep for you. So if you are 30 years old and above, do your cervical screening. If it was abnormal, go back for a repeat pap smear. Don't shy away from your pap smears because you don't want them. It's uncomfortable. It's better to know than not to know what is happening with your body. And then we have a contraceptive. We're also going to offer that outside for anyone who's interested in it. It's to prevent not teenage pregnancies. They say we must say unwanted pregnancies. It could be for adults, it could be for youngsters, it could be anyone that ends up with a baby that they're not ready for yet. So contraception is available at clinics, at day hospitals. You have many forms of contraceptives. You have your oral contraceptives. There's 3 different types of tablets that you can get. So you need to speak to the nurse that sees you so that you can explain to them what conditions you have so that we can see what contraceptive is suitable for you. And then we also have injections, 2 types. You get the 2-month and you get the 3-month injection. Once again, discuss with whoever you are speaking to about whatever needs you have, whatever conditions you have. And then we have the 3-year chip, as they call it, goes in the arm, it's called the implant. And also the IUCD, the loop, goes in the womb and it's for 5 years. And then was now condoms, as we know, and abstaining, as we know. So please ask, it's a sore topic, but we offer it for teenagers and adults, whoever wants it. We never say no to anyone coming to the clinic asking for it. Obviously, we have to exclude pregnancy first. So if you are pregnant, we will not issue you with any contraceptive. We will refer you for antenatal checkups instead. Thank you so much.
Thank you. Before I continue, are there any questions that you'd like to ask Sister Lehman with regards to sexual health and STIs? Remember, it's okay to ask questions, you don't have to be shy, and it's good to inquire so that we know what's going on in our health. So do we have any questions that you'd like to ask anybody? Before I carry on? Okay, she got so. Thank you, Sister Lehman, for that valuable presentation. As we know, as we know, health is not physical but also deeply connected to the mind and emotions. Our next speaker will be addressing the crucial topic of mental health. Please welcome Sister Drea. Sister Drea? Is she here? Not here yet. Alright, no worries. Okay, we now shift our attention to another vital issue in public health, TB and HIV. To guide us through this discussion, please welcome Sister Jackie. Sister Jackie, or Sister Jackie is here. All right.
Sit here. Oh, okay, right, fine.